Hi. What I'm going to talk to today about is my counseling presentation slides. My name is Rupal, and I'm currently enrolled in the class of ethics by Dr. Vera. And I'm going to talk today about counseling in New York State. I currently live on Long Island, and I've been living on Long Island for the past 32 years of my life. I decided to become a mental health counselor, and I already have a master's in psychology. And I would like to tell you about how counseling is in New York State. So, So New York State does have a lot of mental health practices, and there's a lot of confidentiality and rules that we have to follow in order to become a mental health counselor limited permit or a licensed mental health counselor. It is quite a process. It involves being accredited and affiliated with the Counseling Capella University or some kind of accredited program that's CACREP accredited. It involves, 3,000 hours of supervision, some studying, some internships, and all kinds of things. So I'm going to start out the beginning requirements are in order to be a mental health counselor in New York State. So the first thing that you must be is have good moral character. You have to be at least 21 years of age. You have to have possess good moral character in the sense of good, good actions, having good motivations and intentions to helping somebody. So basically, in short, you have to be somebody that's of a helping nature, that's going to help your patients thrive and improve the quality of their life and their beliefs. You must have knowledge of human growth and development. Couples and families know how what a family system works like and possess great knowledge of psychology. So this is the reason why I have a master's in clinical psychology, because psychology will help me to counsel my clients and my patients, will help me to understand, how they've grown up, where they live, and what they're all about. So that's the reason why I have a master's in clinical psychology. We have to be practicing within our scope, so that involves only practicing in areas in which we feel competent in. So, if let's say we're a mental health counselor and we want to counsel people that are suffering from depression and on medications and need therapy, so depression counseling is possible if only if you're very competent in that area and you've been trained in that area and you've been supervised in that area, then you can counsel people for depression and anxiety and what you feel confident in counseling people. But you cannot exceed your boundaries. I mean, you cannot counsel people in things that you're not proficient in areas in which you lack knowledge in. So that is something that you have to be very careful as a counselor, because you can be charged with professional misconduct if you exceed your boundaries. So, keeping in mind that supervision is very important in the counseling profession, we need to have excellent supervisors in order to, to tell us how good we are as counselors and how competent of people we are. Next, I feel that you have to have high qualifications for informed consent. Informed consent is like, letting your clients know how confidential your counseling is going to be, informing them that they are able to get counseled, letting their parents know that they need counseling. If you're counseling a minor, then the parents of the client have to know. It's difficult because it's difficult because the minors are pretty young and they don't understand what counseling is and know what's going to happen to them in counseling. But it's important for the families to know of minors and of in certain cases that their client is going through a certain amount of trouble. Let's say the client is trying to hurt themselves and wants to commit suicide, then we have to break our confidentiality, and I have to let the family know that your child or your family member is in harm of themselves and they need to be get assisted very with serious medical attention. A patient has rights in New York State. We all have rights. Patients have rights. Clients have rights. So they have a right to counseling. They have a right to know what they're being counseled for, what their counseling services include, and how is it going to be in therapy. In some states, especially in the court, if you're on a legal trial, it's important for the client and the court to know that the client is going for counseling. So in some conditions, the court will mandate that they go for mental health counseling. If they're in a serious divorce case, and and the court says, hey, my client is seriously terminally mentally ill and needs to go for counseling, drug abuse or substance abuse, you will have to go for counseling, and I will have to let the court and the probation officers know that my client is getting counseling for their problems. So in counseling sessions, there's a high amount of confidentiality, and maintaining professionality. So in the counseling profession, both the counselor and the client have to maintain privacy. Obviously, after you sign informed consent forms, there's a high degree of privacy. Whatever happens is going to be strictly in the counseling session. Nobody outside the counseling relationship will know of the counseling that is taking place. And I can share you as a counselor that all of my counselors in New York State, they're licensed in New York, are highly responsible and acknowledging of the fact that our clients need help and they want their emotions, they have a right to their own privacy. So when they sign papers, the counselor must, address papers and give them papers to sign while they're before they start the counseling session. It's like a medical form. It's like going to a doctor, basically filling out your health forms, knowing that you're starting counseling initially for the first time. This is your first time in therapy. Any medical problems that you have, this is between me and the counselor, me and my client. And the client has every right in signing and knowing what exactly is being offered to them. And the patient will always have, my client will always have access to their records. If there's any reason where I have to terminate counseling and have to transfer the records to somebody else, my client will know. I will inform them that I need your consent to send your patient records to another counselor for counseling. And that does happen, and it's a smooth transition as long as my client is aware of what's going on. So we also have telehealth and distance counseling. And telehealth is where we offer distance counseling in situations like COVID. Nowadays, since COVID is so popular and it's a worldwide pandemic, we have distance counseling, which is working basically from home on a remote distance counselor using technology. And that technology is very important for our clients to understand how to use because they need to be educated about the technology. Time differences are different. If I'm in one state and my client is in Florida, we're both on the East Coast, so we're in Eastern specific timing, Eastern Standard Timing. So we need to know the time differences. We need to know if the counselor is going to be there. What if they need to reschedule their appointment? What if my client is not going to be able to come in one day for one session of telehealth counseling? What happens? How do we reschedule the appointment? So all these things need to be notified in a distance counseling manner via video conference in a professional, in a very secure form of communication. We have to make sure that nobody else has access to any of our counseling records. It's quite a deal with all the informed consent and the privacy, but we have to make sure that our clients feel secure about this, that no third party or nobody outside is going to know about this counseling session except me and the client. And telehealth does have its limits in New York State, unless there's some kind of family emergency and they're just a big emergency and I need to break my confidentiality. Again, we have to apply confidentiality measures and standards to our counseling practices. Social media is a big thing for counselors. If you're a mental health counselor or you're a psychologist, we cannot be sharing anything about our patients on social media. No doctor, no nurse, no therapist, no psychologist or social worker will share anything about their clients on social media at all. It's a big no-no. It's a big violation of our patient privacy. It's a big HIPAA violation. We could lose our licenses and we can be fined. We could be charged with felony if we ever, posted any patient information on social media. So that is a big no-no. So telehealth is basically providing any kind of assessment, diagnosis, and intervention through video technology, through video conferencing. As I mentioned earlier, there's a lot of limits to mental health counseling via distance counseling. There's limitations. And New York does allow telehealth mental services because since COVID has happened, we need access to things online. And things need to be taken care of online. It's easier for our clients to stay in touch with us at their own convenience from the comfort of their own homes. And it's a very convenient measure for us to talk to face online without having any kind of interruptions. But at the same time, I do have a lot of clients that want to be doing counseling face to face because they find it to be more professional and less limiting for them to express themselves. So it is an excellent medium to work face to face as well as online. And telehealth mental services are always reimbursed by New York State. So distance counseling and practices is in large scope, and we also have limitations. As I mentioned earlier, if the technology fails, if our technology is not working, what happens then? How do we reschedule? How do we figure out time differences in counseling? It's like doing a Zoom video call like, talking to your friend on WhatsApp from another country, basically. But this time, this involves more secure form of communication. There's papers, there's formal informed consent that needs to be passed in between counselor and client. And we have to make sure that none of our relationship is going to be violated by any third party or anybody else. So it's all secure form of communication. In the first case, I'm going to talk about the application in rural areas. If we're working in a rural area instead of a suburban area, we are tempted to violate our boundaries because everybody in rural area is not as formally educated as people in suburban areas. So we are tempted to break our confidentiality, and that is something that we have to take into consideration as counselors. We have to maintain our boundaries. I understand that it's very tempting to break laws and ethics while counseling in rural areas, but we have to maintain it. We have to make sure that we provide enough education about technological services and telehealth counseling and informed consent. We have to let the appropriate parties know that they deserve an informed consent while getting counseling. We have private chat rooms available, but unfortunately, chat rooms are very, very violating of privacy because it's a chat room and anybody could get access to what we're talking to. So it's not a secure form of communication. If I needed to do a distance counseling session with you, I would probably prefer something that involves secure communication because private chat rooms are very easily accessible from a third party and anybody outside could get access to what we are talking about. That's why I highly discourage private chat rooms in counseling. See, like as I mentioned earlier, chat rooms are insecure because anybody that participates can easily get access to what the counselor and the client are talking about, and the communication is not very secure. It's insecure. So I highly discourage it. I believe that cyberbullying is also a major issue in chat rooms. There are some people that enter chat rooms and start virtually abusing people, and that's a big no-no. Cyberbullying is a major mental health challenge that we need to tackle today. It happens everywhere. It's a major issue in social media, the cyberbullying. It's very unsafe, and that's the reason why I refrain from using social media as a mental health counselor because it's very unsafe, and people have access to all of your information and what's going on. The reason why I find it to be highly insecure is like, what if one party or the client decides to be irresponsible and expose what's going on? So therefore, there needs to be a secure form of communication, maybe a secure email or a secure discussion group that we could participate in order to do the counseling. So in the case of Dylan, I would have to break my confidentiality because he's participating in illegal activities, drug abuse, and his bad habits of stealing. And in this case, the court would mandate Dylan to go for counseling because he would need to work on his illegal activities and his dirty, bad habits. So basically, if Dylan is entering counseling, I would inform Dylan that he needs to be seeing a counselor for his mental health illness of stealing and hoarding and illegal activities. I would make sure I let the probation officer know that Dylan is in counseling sessions. He's going for therapy, and I would have to share my session notes with the probation officer and make sure that Dylan is making progress in counseling due to his illegal activities. I would basically keep a secrecy and maintain some kind of privacy, but I would let Dylan know that I'm letting the probation officer know about the counseling sessions, and I would have to inform them on a weekly basis about what is going on. So in the case two, Darren, he has the right to informed consent, just like Dylan. I would let him know about his rights as a counselor and also the confidentiality that's being maintained. And I would talk about the session and its secure communications. And I would make sure that Darren is not being affected by our relationship at all. I mean, he has to feel okay with me sharing information to the probation officer. I need his consent, and I also have to let the probation officer know, like every single week, that what's going on in the counseling session if my client is making any progress.